If you are pregnant or you've recently had a baby, this podcast is for you. I'm your host, Kath Bequee. I'm a physiotherapist working in women's health and mum of 3. Inside my online program, Fitness Mama, I help women feel confident and strong inside out as they navigate pregnancy, birth, and postnatal recovery. Each week, I bring you 2 episodes to support you on your motherhood journey, whether it's real and raw birth stories from fellow mums, expert interviews with trusted health professionals, or bite-sized Q&As where I answer your most common questions. It is possible to feel amazing in your body during this stage of life, and I want that for you. Come and say hi on Instagram at kathbequee.physio, and let's dive into today's episode. Hello, welcome back to the Pregnancy, Birth and Recovery podcast. I've just finished the most amazing interview. I chatted with lovely Eugenie, who's got baby Louisa. It's her first bubs, and this story, it's a beautiful, positive induction birth story, but Eugenie also shares her challenges with mental health and anxiety and eating disorders, and she's really open and honest, and I so appreciate her sharing her story today, because I think for anyone who's looking for a beautiful birth story, or anyone who has got some mental health challenges, anxiety or eating disorders, I think this will be so valuable. In this story today, Eugenie talks us through, as I mentioned, the mental health challenges, but the induction birth story. It's a beautiful, positive one. It involves TENS machine, calm birth preparation. She does have an epidural, no instrumental delivery. I won't give it all away, but it's a great one. Thank you, Eugenie, for sharing your story. She's a beautiful member inside Fitness Mama, and she also shares how the app supported her in her postnatal recovery as well, and how seeing a pelvic floor physio really helped to support her physically, pelvic floor incontinence and the recovery side of things too. So without further ado, let's get straight into it. Thank you once more. I know I've mentioned this recently, but the main way this podcast grows is when you share it, when you share it with your friends, when you rate it on your podcast app, when you give me a review. It helps with the algorithm, and I don't run ads to this podcast, and it's how this podcast absolutely grows. It's the only way it grows. So thank you so much for supporting the podcast in that way. A big shout out to a recent review just last week saying, I love this podcast. It has a variety of information from a range of health professionals. The conversational nature of the podcast makes it easy to listen to. So thank you, NK Jen, for leaving that review. I really do appreciate it. Okay, let's dive into this episode today with Eugenie. Eugenie, thank you so much for joining me on the Pregnancy, Birth and Recovery podcast. It's always an absolute honour to have a chat to one of my beautiful members inside the program, Fitness Mama. Thank you for, volunteering to come on and share your amazing story.
Oh, thank you for having me and giving me this opportunity.
So Eugenie, first bubs, how old's Louisa now?
She will be 4 months on Sunday.
Yeah.
So, yeah.
How's motherhood been? I know it's a very big question, but how's the last 4 months? How's it traveled?
Yeah, it's amazing how I feel like it's gone so quickly, but also how I feel like I'm like, oh, has it only been 4 months? Like she feels like she's been here for so long. Um, I think I've been incredibly lucky to have had a pretty like smooth start to motherhood in terms of having had a fairly straightforward pregnancy, birth, and then, that setting me up for an easier recovery, I think. Um, But I do also think that there was a lot of things that I tried to put in place, like during my pregnancy, and then even, reassessing postpartum to try and just make sure that we could have like a smoother introduction to that, motherhood and Louisa's life, for her. So
Yeah.
I would say, yeah, we've been incredibly lucky, both, maybe because of some conscious things that we chose to do, but also I think Louisa is a very um, calm and happy baby.
Yeah, beautiful. And I know we were discussing this just off air, but for you've got, as we were talking about, you've got a very unique story, but it's also a story I think a lot more women would resonate than we know and understand and realize in society. Do you feel that your mental health played a big role in helping you to be very proactive about getting that support
Mm,
postpartum?
absolutely. Yeah. So, yeah, as we were sort of discussing, like, um, my mental health history goes back to sort of, childhood and my teenage years, where I developed an eating disorder around the age of 16 and had anorexia. Um, and that, kind of played out over my, late teen, early 20s, but even for up to sort of 12 plus years where I was still probably, um, kind of just underweight and bobbing along, not really kind of on the radar of sort of health professionals at that point, but still, unwell in some ways. And actually, throughout that period, I, wasn't getting a period. And I always knew that I wanted to become a mum. And so that was always something in the back of my mind that, if I'm not getting my period, how can I get pregnant? And um, I think then, when it kind of came to that point of meeting my now husband, um, I think that was one of the impetus for me to really then seek more help and start to get better. And I did actually get my period back, fortunately. Um, but I think that, experience of that eating disorder, along with that, I have a history of anxiety. And so I knew that, if I was going to achieve this goal of becoming a mum, that I would have to really be conscious about that, both in managing my mental health and then managing that, through the pregnancy and then into the postpartum period. Um, and I think, some of the things that were really helpful were making sure I sort of had that team approach, with my GP, I have a psychiatrist, psychologist, dietitian, making sure that, in my pregnancy, I had a pregnancy care provider that was on board with that and really understanding, of that history. And then there were some things that we did, like, choosing to stay with my parents for the initial kind of few
Okay.
weeks,
Yeah.
and then that sort of thing. I've sort of
Yeah.
sort of waffled on
That,
about that. I don't know if
so
that's relevant.
taking no, that's great to hear. Taking it back to like what you were mentioning, and let
Mm.
me know if you want to like no more questions about this because I know it can be
No, no, no. I'm
like
like more than happy to talk about that.
yeah. I was just wondering like
Let me
how
just go and grab Louisa.
sure.
She's just woken up.
So Ray, if you could cut from around that time that Eugenie was talking about going with the parents, and we'll pick it up from there. Oh, there she is.
Hello.
And Eugenie, one more thing is, could you with the Zoom change the input put to your computer audio, and then just have the speak. So change the microphone to your computer audio, and then change your speaker to your AirPods.
Absolutely.
Thank you.
Select a microphone. Eugenie's MacBook Air
Yeah,
microphone.
that's better. Amazing.
AirPods Pro is my
Yeah.
Wait, sorry, microphone, select a
Microphone,
speaker, that'll be the AirPods.
microphone, yeah, your computer, speaker, AirPods. Just so that the audio is, it sounds much better not on Bluetooth.
Oh, that's good to
Yeah,
know.
but
Okay,
then the audio's not picking up my words, so that's perfect.
perfect.
Okay, so let's take it up. We'll, from that point, just you started then talking about how you were supporting with your mental health in the postpartum period. So, Eugenie, taking it back to what you were just mentioning, if you're happy that I ask a few questions about this, you mentioned that when you met your partner, you decided, okay, now it's perhaps I'm ready to, and like correct me if what I'm saying is coming out wrong, but you decided that was a time, that was like the incentive to really go about, helping support your body and your fertility and get your period back. How long
Mm.
did that process take?
Mm. Well, actually thinking about it, it was probably a couple of years into our relationship that I think when you're sort of living with someone and you have an eating disorder, it's very obvious. And I was open with my husband about that, before we were, early in our relationship, before we were engaged or, married or anything like that. But it's incredibly hard on a relationship. And I think that it got to a point where my husband was sort of, um, really sort of pushing me that if I wasn't able to kind of get help and get better, it was going to be, really detrimental to our relationship. And I think for me, I sort of really realized, wow, I could lose this person who's become so incredibly important to me. Even though I was scared, I sort of the first thing I did was make that appointment with my GP and just sort of let her know everything that had been going on. And she was fabulous and immediately sort of referred me to a psychologist and a dietitian and really got this amazing team around me. Later we added in a psychiatrist. I started medication for anxiety, and that was the start of 2021. And it probably, took a few good years. Um, I should say before that, I had sort of gained some weight and got my period back. So, like physically, I was better, but there was still that mental side of things that was really challenging. And so it was probably that 2021 kind of where I started to really more work on the mental health
Yeah.
side of things. And
And how old were
uh,
you at this stage? Because you mentioned you first sort of had it
yeah,
from 16.
yeah. So sort of from yeah, 16 was when it sort of started. I probably got my periods back when I was yeah, about 27, 28. So it was actually a period of about 12 years that I didn't have a period. And then yeah, early 2021 I would have been yeah, 29 at that time.
Yeah.
And I think it was really only even in the last year before I got pregnant, so, start of 2024, that I really felt like, yeah, okay, things feel stable enough now that I could actually, get pregnant and bring a child into our lives.
Yeah. What a journey for you.
Yeah, like it definitely was a journey, but I think I've learned so much through that and, definitely did inform those decisions that I've made around, yeah, motherhood, pregnancy, birth, postpartum, and certainly is going to, inform how I, parent Louisa as well. And, just doing what I can in our home to, reduce the risk that she might develop an eating disorder.
Did you know one of the best ways to support your postpartum recovery is through exercising carefully during pregnancy and preparing your body for birth? And this is something we cover inside Fitness Mama. This is what fitness is all about with its physio created workouts. We help you support your changing body during pregnancy, whether or not that's with pelvic girdle pain-friendly workouts, whether or not that's with strength training for pregnancy or pregnancy yoga. We help you to prepare your body for birth and reduce your risk of third and fourth degree perineal tears and episiotomy. And we help to boost your postpartum recovery, whether or not you've had a vaginal or a cesarean birth. If this is something you want to do, then come and check out our free 7-day trial. You've got nothing to lose, everything to gain. And at the end of the day, it's all about helping us have a better motherhood experience to help us feel stronger inside out in every aspect of our life: physical, mental health, confidence. Anyway, I could keep on going, but come and check out the link in the show notes and join our free 7-day trial. See you soon. I guess that's the big question is, and I've got 3 daughters
how do
here,
you do
so
that?
and we didn't mention off air that you are also a health professional yourself, but with 3 daughters, how, knowing what you know now and you've come out the other side, like a massive journey, you've got a beautiful little baby, 4 months old, and this is a whole other podcast topic, so we haven't got to your birth yet, but I would love to know what are some small things you would implement or be mindful of.
I think, this is such a learning journey even for me, and something that, she's certainly not eating yet, but well, eating solids yet, obviously. But I think, something that we do even try to do with her now, listening to her hunger cues already and really trying to nurture that sort of inbuilt, appetite that we all are born with, but that so often gets kind of sort of, we overrule that with, diet talk or, just sort of pressure to, finish our plate, but also, these messages that certain foods are good or bad and things like that. So I think something that we'll certainly be conscious of is, just creating a positive environment when she starts solids, not, offering those foods, but not forcing her to finish anything that she doesn't want. And really trying to avoid any talk about diets, our bodies, and just really having that positive body kind of, talk in our house.
And I have done, for those listening, if you are interested in this topic, I will link in the show notes a brilliant, I think I've got 1 or 2 episodes with dietitians discussing starting solids and baby meal times, where they do go into everything that you've just said, Eugenie. So I'll link that in the show notes.
So helpful, yeah.
Okay, so let's get back on track, Eugenie. You find out you're pregnant. How was did it take long to conceive?
I think I always, again, because of my history, I had this sort of notion in my head that it would take some time to get pregnant or something. And I once my periods came back, I did actually start the pill because I, didn't want to get pregnant. And I should say also that even when I didn't have periods, I was, using contraception because I knew that there was, that small chance you could get pregnant even if you're not having regular periods. But I came off the pill sort of quite a few months before I knew that we were ready to conceive, because I wanted to make sure that my periods were coming regularly. Unfortunately, they did. But I think, as you said, I'm a health professional. Certainly, in terms of what I would advise my patients about contraception, I wasn't doing. And so whilst it was very much planned in that, I was taking all the supplements, I was, doing things like, I wasn't drinking alcohol, when I knew that I, possibly could conceive. Certainly wasn't being as careful as I might have been had I known I would, fortunately fall pregnant so easily. And so it did happen probably a few months before we thought that we would start trying. So that was actually really nice. We didn't have that kind of waiting time or, that sort of obsessive peeing on the stick sort of thing. And I actually, yeah, I got a couple of colds, which I thought was a bit unusual. And so, yeah, did a pregnancy test and to my, shock, it was positive. And um, yeah, that was a really exciting time. And certainly, even though, we hadn't, been planning to try for a couple of months, we felt very ready and excited
Yeah.
that we were pregnant.
Yeah, beautiful. So how was once you found out you were pregnant, like how was your first trimester? Like how did the pregnancy transpire?
Yeah, I think again, I was so lucky. I had really mild nausea, maybe week 6 or 7. Um, and the main symptom for me, in the early part of pregnancy, probably up until at least like 16 to 20 weeks, was fatigue. Um, but we had all those, early tests, ultrasound, things like that. Everything um, looked really good. And fortunately, we didn't have any sort of uh, I didn't have any bleeding
Mm-hmm.
or any, sort of things that might have been sort of concerning for me.
Yeah, amazing. And as you went into your second trimester and third trimester, how did and going back to the mental health side of things, how was that? Was it a big adjustment for you?
I think definitely, as I started to show around sort of 18, 20 weeks, I definitely found that hard, that, really rapid change in my body.
Mm.
Um, and that was definitely an adjustment. I also found that I really noticed sort of in that mid second trimester, I started to get reflux, and I found that I just got full so quickly, which I found really hard to manage mentally. And that was something that, I discussed with a psychologist, dietitian who I was still seeing throughout my pregnancy. Um, and then also with my obstetrician, I was able to kind of start some medication for the reflux, which was really helpful. He also gave me some medication that I could use if I was feeling, that I was particularly full, some medication to help sort of just move things along in my digestive system a bit quicker. And that the those things just were so helpful, I think, in just helping manage that mental side of things, because even though, you know, I was well recovered at this point, there's still those little things that can trigger off those negative thoughts or cycles with food. And so I was really conscious that I didn't want to be accidentally under eating when I'm really trying to nourish myself and my baby.
Mm. Yeah. There's a lot, like when you think with pregnancy, if
Mm,
it's enough for anyone, and then if you're also layering on top anxiety and the
mm,
history, it's
mm.
huge.
Absolutely. I think though in some ways I was really lucky because I had had these experiences and I was so conscious of um maintaining my mental health, whereas as you said, pregnancy is, such a difficult time for, everyone. And if you've never had any mental health struggles before, pregnancy might be something that triggers that. And you might, we're so lucky that, especially in Australia, we do have access to a wonderful healthcare system. But if you've never kind of had to seek that help before, you
Mm.
just might not know really where to look. And so I think for some women that can be very hard too. And so raising that awareness around, mental health or eating disorders or things in pregnancy, um, yeah, it's really
Mm.
important.
Yeah, absolutely. So you're traveling along your second trimester. Any issues with
Mm.
pelvic girdle pain, discomfort?
Fortunately not. I had, yeah, again, just such a breezy pregnancy
Yeah.
physically. I think I really found it easier, especially once I got to that third trimester, I was really actually embracing my new body, loving, seeing my bum,
Yeah.
loving feeling Louisa move
Yeah.
inside. Um, I didn't get sort of really any aches or pains beyond, sort of occasional just back pain
Yeah.
that would go away after a good night's sleep. And I was able to keep active in that, I could walk, I could do some exercise at the gym, just some, pretty gentle strength kind of strength
Yeah.
workouts with a little bit of sort of low impact cardio. And that I think really helped just help me to feel fit and make sure I was going into my birth and postpartum as the strongest that I could
Yeah.
be.
Okay, so you're in your third trimester. At what stage did you really start to think, oh my gosh, birth's approaching, what are we going to do?
Yeah. Well, I think actually, as I said, I've been wanting to be a mum for so long, and it's something that's always just fascinated and interested me. So it's definitely like I had been, listening to birth podcasts for years and reading books and all that sort of thing. And even from the start of pregnancy, I was sort of reading books and thinking about how I wanted to best prepare for birth. I um, my husband and I did do a calm birth course, which we found really helpful. And I think for me, I just really wanted to remain calm, during the labor um, and birth. And it was great for my husband too to have that sort of, he's actually medical as well. And so for him to have that kind of a bit more non-medical kind of approach and overview of birth was really good, and helped us to feel like a team going into it. I also did some online hypnobirthing like tracks that I found really helpful in the last few weeks. I'd listen to them before bed, and it really helped me keep calm and just have a positive mindset. Um,
And did you always know you
I
wanted to go down the vaginal birth route if possible?
think that was always my goal. Probably a couple of years ago, I kind of wavered. This was way before I was even, pregnant. I was like, maybe I should just have a cesarean. It'll, I won't have any tears or anything like that. But then, you learn that actually pregnancy itself is, a risk of pelvic floor weakness and prolapse, and you're not you don't get off scot-free with a cesarean, and it's obviously major surgery. So I thought I'll give myself the best chance to have a vaginal birth, but whatever happens on the day, or if something in the pregnancy necessitates a cesarean, I wasn't going to be, disappointed with that. Um, I did see a pelvic floor physio and started my pelvic floor exercises and learned how to do perineal massage as well.
Yeah. How did you find that
Um,
from, I guess, a patient perspective?
yeah, that was really interesting. I actually really I didn't enjoy doing the perineal massage at all. Um, but the pelvic floor exercises were great, and something I'm still doing, and obviously so important after giving birth. And even just, yeah, I mean, pelvic floor physios are amazing. And, I had sort of referred to them before, but being on the patient side
Yeah.
and seeing what you guys actually do, I'm so in awe. It's amazing. Yeah.
And again, you don't have to answer this, Eugenie, but having that history of anxiety, did you have overactive pelvic floor?
Actually, I didn't. I think that something that I had actually seen a pelvic floor physio probably about 10 or more years ago when I was in uni. And yeah, now that you sort of say that, it probably, I was having, yeah, issues with overactive pelvic floor and having some urge incontinence. And so it was something that I had worked on at that time and had been really successful with the pelvic floor physio. And so probably uh, through that, yeah, fortunately, I didn't have an overactive pelvic floor, um,
Yeah, interesting.
but yeah,
Yeah.
yeah, and we now that you say that though, I do remember that definitely I was focusing a lot on the relaxing and making sure that I could do that properly.
Yeah,
Yeah,
amazing.
for sure.
And for those listening, we know that perineal massage and having that great awareness of your pelvic floor, not just the lifting and the contracting and the strength, but also that relaxation, it really, there's research to show it does help improve birth outcomes in terms of reducing the risk of third and fourth degree perineal tears and episiotomy. And yeah, so it's a really exciting area because there's a lot of research evolving in this area, but there's a big push now with preventative treatment like what you did, Eugenie, rather than just, oh, I've had my baby, I've got some leaking, let's go see a pelvic floor physio. So many more women are now coming in and seeing me in the clinic when they're actually pregnant saying, oh, what can I do to help reduce my risk? So amazing that you went along to your pelvic floor physio. Okay, so you've been doing your perineal massage. You are approaching the pointy end of pregnancy. At what stage did you realise that, or did you go into labour naturally?
So I really had this mindset that Louisa was going to be coming out at like 41 weeks, and it definitely wasn't going to be an early sort of earlier birth or anything like that. But actually, at 36 weeks, my waters broke. It wasn't a big gush or anything like that, but I did have a little sort of trickle of amniotic fluid coming out. And but I didn't actually actively go into labor. So noticing something different, I called the birth suite at the hospital and sort of went on in to be checked out, and they did confirm that it was amniotic fluid. But given that both baby and me were well, my obstetrician was happy for us to start some oral antibiotics to reduce the risk of infection now that the sort of amniotic fluid and the bag of waters had broken. And then he really wanted to get Louisa to the 37-week mark just to give her that extra growing time inside. And so the plan was that if I didn't go into labor before and, being that we were both well, we'd get induced at 37 weeks. And so that was sort of, a week later, we went into the hospital and had an induction. Because my waters had already broken, I didn't need to have any ripening of the cervix, but I had the syntocinon drip to kind of get the contractions started.
So you went into hospital knowing that you'd be induced. How was that? Can you remember that car trip? Can you remember that morning?
Yeah. Well, I mean, I should say the couple of days before I was really nervous about being induced. I think that was something that I was sort of hoping to avoid, but obviously the situation necessitated it. So I really tried to change my mindset and then kind of, did a deep dive on the internet to, all the positive induction birth stories that I could possibly find. And I listened to those and, was still trying to I was, rocking on my birth ball and, just trying to do what I could do to ready my body, even if it wasn't going to go into labor itself. So yeah, we went to the hospital really early on the Thursday morning, and it was kind of like, we're going there and we're not coming home until we've got a baby. So we were really excited, I think, by that point.
Yeah.
And I listened to some of those hypnobirthing tracks, which I found just really helped to keep me calm. And that was just so nice to have that calm, positive kind of mindset going into the day.
Yeah. And how was your partner? How was your husband going at this time?
Yeah, I mean, he was quite nervous, I think. He sort of called his mum and she was like, and said, I'm really nervous, mum. And she was like, don't be nervous.
Or don't be nervous to you, Eugenie.
Yeah, exactly, right. But he was great. He was so helpful. I'd actually organized, hired a TENS machine, but done that, way earlier in the pregnancy, and sort of thought, I'll get it around 37, 38 weeks. So it actually arrived that morning when we were already at the hospital.
Oh.
So luckily we live near the hospital. So my husband was able to quickly pop to the post office, grab the TENS machine and come back to the hospital before they even started the drip.
Yeah.
Because I think I really had in my mind, I was like, I need my TENS machine. I'd never used a TENS machine before, but I'd really had this mental, I really want the TENS machine. I think that's just going to really help me,
Yeah.
And it was helpful, for sure, in that, especially that early part of the
In
labor.
what way?
I think, it did provide that helpful distraction. I definitely found, though, the sort of sensations that it was giving were, yeah, it just really did help to reduce those sort of, the sensations that I was experiencing. But I think I'd sort of underestimated just just how sort of immobilized I'd feel with the induction being hooked up to so many different a drip. You've got the pulse oximeter on one finger, you've got the CTG and the sort of the monitors on attached to your belly. Even though they were wireless, they kept on sort of if I would move much, they would fall off her heartbeat and then, trying to readjust that. And so I was sort of initially sitting on the side, like sitting at the side of the bed on a birth ball, kind of bouncing and rocking. But I felt like I just wanted to go to the bathroom and sit on the toilet. But because of all the things I was hooked up to, and then, with the monitors and things, I knew it would all just sort of, it just wasn't going to work. So I kind of stayed in that position. And yeah, I was using the tens. I was really trying to listen to the hypnobirthing tracks, but I found I just really couldn't concentrate on them with everything else that was happening. Um, yeah, the monitor kept on falling off her heart rate, and then her heart rate started to rise, and the midwives weren't happy with it. And so that was quite distracting too. And at that point, they wanted me to get on the bed so that they could try and get her heart rate at a better place. And I think for me that just sort of made the contractions that much more intense. Um, and I really felt like that was only, maybe 3 hours into the whole process of like having the drip. And I kind of had in my head that this induction was going to be at least a 24-hour, if not longer, kind of process. So I was sort of like, look, if this is how it's going, I think I'm going to want an epidural. And so I did ask for that. And fortunately, the anaesthetist came very quickly and put that in. I had sort of had the idea before kind of labor that I might want to, see. I really wanted to see if I could not have an epidural. My mum, back in the 90s, she didn't have epidurals for her three births. My sisters had two births without an epidural. And I thought, yeah, like genetically, I've got this history, I'm sure I can do it. But I also knew that I have quite a low, pain threshold, and I'm quite happy to take medication if I've got a headache or, I think what's the point of being in pain if I don't need to be? Um, and I think, some of the things that I was worried about with an epidural that it wouldn't work, or that it might be, quite uneven, or that I would really be immobilized in my legs, or might not be able to feel the contractions when it came time to push, or that it might increase my risk of an instrumental birth, or things like that. All these things that were just sort of preconceived notions that maybe, certainly, obviously, it doesn't always work for people. Um, but I was so fortunate that I had a really effective epidural that was very even. I had full still motor movement in my legs. I just could no longer feel the contractions. And so I got that. I was able to kind of relax and rest for a couple of hours. And then sort of the first time my obstetrician actually came to check me, he had popped back a couple of times just to sort of see how I was, but he hadn't actually checked the dilation. We started the drip at about 10:15, and then he came back at 4:30, and I was actually fully dilated, which was such a shock to me because I'd expected it to be, yeah, such a long process, being my first birth, being that I was only 37 weeks, and kind of had that feeling that, she wasn't quite ready to come, even though my waters had broken. So that was really, really good. And then after that, I no longer, I had the little sort of PCA button to press to release some more medication through the epidural. I didn't press that again so that it could kind of wear off a little bit. And I did start to feel a lot more pressure with each contraction. They wanted to wait just an hour to give her kind of that like passive descent, they called it. where she was sort of coming down with the contractions further into my pelvis, even though it was already sort of fully dilated. So we did that, and then at 5:30 I started pushing. Um, yeah, and I actually had a beautiful student midwife with me who'd followed me throughout my pregnancy, and she was there for the birth. We had the birth suite midwife and my obstetrician, and they were just so great. And of course, my husband, he was a real pro with the pushing part. He was, yeah, right there, just encouraging me. And I must say that was a very intense experience, but yeah, such a positive one. And about 50 minutes later, she was born, and yeah, didn't need any instrumental delivery. Um, I had a small amount of blood loss, and fortunately, I didn't have any like big tear. I had some grazes,
Yep.
a graze in the vagina and a bit around the
Yep.
urethra, but other than that, no
Yeah,
tears.
amazing. So when it came time to push, you mentioned you hadn't been pressing the button, so it had been wearing off.
Mm.
Did you have an urge to push?
Absolutely. That I found so helpful because I knew exactly when I needed to push. I didn't have to be kind of told
Mm.
to push. And so they kind of just said to me, once you get that urge, I did definitely have that kind of, coached pushing. I think another idea I sort of had during my pregnancy was that I didn't really want to be giving birth on my back. But, with the epidural, obviously you're slightly more limited in the positions you can assume to give birth. But, my obstetrician came in and he was like, are you happy there? Like, do you want to move positions? But actually at that point, I felt really comfortable and I felt like that was actually going to be a
Mm.
good position to give birth, kind of in that. Um, I was very much sort of sitting up, and then my midwife and student midwife were able to kind of hold my legs up. I didn't have them in stirrups, but it was kind of like they were
Mm.
acting as the
Yeah.
stirrups. And I found I had a really good, yeah, I just had that such a strong sensation to push, kind of that pressure in my
Yeah.
bottom. Um,
Amazing.
and they were able to kind of coach me to, what I needed to do with my breathing and
Yeah.
things, which again, I found so helpful.
Mm. And I think it's really important to highlight the fact that, and I've got I've got a podcast interview lined up next week actually, where I'm interviewing an obstetrician all about pain relief options. But I think it's really important to highlight a lot of the research which paints epidurals in not a very favourable light. These research articles are quite old, and they're the very old epidurals with the dense blocks where there's no
Mm.
sensation, and there's no sensation like how to push or where to push or what to push. So
Mm.
and in terms of pelvic floor outcomes, I think, yeah, the research isn't great, but there is research, and this is what I'm going to quiz the obstetrician on next week. I believe there's research coming out with the newer epidurals that are, and of course there's lots of things at play, and I'm only discussing pelvic floor outcomes here as a pelvic floor physio, but I believe that the newer epidurals are actually, they're finding they're protective of pelvic floor issues postpartum. And that makes sense because what happens is when we're in pain and discomfort, our body naturally tenses up, and our pelvic floor muscles tenses up and sort of closes off the birth canal and closes up the birth canal. Whereas when we're relaxed and we're not in pain, and this is where all the calm birthing and hypnobirthing and all those methods are so important, because it helps to relax the pelvic floor, open up that birth canal. And so it's a really interesting area, like birth pain relief during labour.
Mm.
And as I said, there's lots of things at play, and it's not just all about pelvic floor. But yeah, it's interesting your experience.
Yeah, I mean, that's so great that they are like doing that research and bringing that out because obviously there's so many different options and things, but it's so funny how I had this preconceived notion about like what I wanted my birth to look like,
Mm.
probably as natural and as, kind of, I mean, natural in inverted commas, but, as kind of minimal intervention as possible. But I think reflecting on that, the reason I kind of thought that I wanted that was because I wanted to have a calm kind of birth where I felt still in
Mm.
control and that I felt I had kind of agency over my body and that I was being respected and um, that, just this positive birth experience. I'd heard a lot about birth trauma and, read about that and, thinking about how I could prevent that happening to me. Obviously, there's a huge element of luck and that sort of thing, but thinking about, what things I could do to kind of reduce that. But I actually had the exact birth that I wanted. It was calm, I felt in control, I felt listened to, I felt cared for. Um, and though part of that was because, um, even with the induction, and the epidural, those were tools that actually really helped me to achieve that birth, that I wanted.
Yeah, amazing to hear. So you've got little gorgeous Louisa on, you've given birth, no instrumental delivery, any tears?
Just a graze. I had a graze in the vagina and then a couple of little grazes around the urethra. But I didn't need any sutures. And yeah, that was, I mean, obviously, anyone who's given birth, regardless of any tears or anything like that, there's still that discomfort. And I think, ice, paracetamol, ibuprofen, all those things was so helpful for me. But it did mean, again, it just sort of helped set me up with that positive kind of recovery postpartum, not being, in too much
Yeah.
pain or anything like
And
that.
did you know you're having a little girl?
Yeah, I did. We did find out around 13 weeks that we were having a
Yeah.
girl. So yeah, we'd already actually chosen the name. So,
Yeah.
when we came out, we were, yep, this is Louisa.
Uh,
Um,
and
yeah.
how do you remember how you're feeling in those few minutes after giving birth?
I think I was definitely in shock. Um, they immediately put her on my chest. I think I was just like, whoa, what just happened? Kind of feeling. I didn't, cry or anything. I think my husband did get teary, but I think I was just sort of in shock. And then fortunately, she was really well, so she didn't need to be moved off me or to have any checks away from me. They were able to do that all while she was on my chest. And she did stay on my chest for about 3 hours, which was obviously amazing. But I should say, I think obviously there's so many benefits to having that skin to skin time, and I'm so pleased that we got to have it. But I think it's good to normalize, I mean, how I was feeling. Like by the end of it, I was kind of like, oh, I really just want to get up and have a shower. I'm kind of feeling gross now. Like this is really lovely and everything, but I'd love to just hop up, go, kind of have a shower. I was feeling really sort of sweaty and, all the amniotic fluid and, blood and things. They like cleaned some of it up, but I just felt like I just wanted to hop up and have a shower. My back was a bit sore from kind of, I think obviously having just given birth and then being in that kind of position in the bed. And so I was sort of, when they sort of said it was time for her to, be weighed and checked and dressed, I was happy to kind of hand her off to my husband and be able to kind of go and have a shower
Yeah.
and sort of just re just sort of yeah, kind of get back into my pajamas and things before I was kind of, then able to have her back on me, and that was really nice.
Yeah. Did those 3 hours zoom by?
Oh, absolutely. Gosh, I can't believe it was 3 hours. Like even just that whole time in the birth suite afterwards. I think she was born at around 6:24, and we probably stayed there until about 11 o'clock, but it just went so quickly.
Yeah, interesting. I think back to my babies, and I'm like, there's no way I was lying there for 3 hours, but perhaps it was. Like, it just feels like
Yeah,
a
yeah,
blink of the
absolutely.
eyes.
Like, yeah,
Yeah.
yeah.
And did you try your first breastfeed in that time?
Yeah, well, actually, I had made the decision during pregnancy that I wasn't going to breastfeed. Um, I I'd always thought that I would breastfeed, and it was something that, again, I found so interesting and fascinating. But towards the sort of middle of the pregnancy, I really had a lot of feelings that, you know, um, that both I didn't want to do it, and also that I was really worried about how it might impact my mental health. Certainly there, there's no like evidence, I think that, that women who breastfeed get less sleep than women who don't and things like that. But I certainly knew from experiences of friends and family, as well as, my own patients, seeing, just how sleep deprived women can sometimes become with breastfeeding. Um, and I was really worried about how that would impact on my sort of anxiety. I also worried about being the only person who could sort of feed Louisa and, not being able to kind of share that role with my husband. So after a lot of kind of, deliberations in my mind, I decided that we would formula feed Louisa. I did want to express colostrum though, antenatally, and I did do that from about, I can't quite remember when I started, but it was only a short amount of time given how early she was born. But I did get about 90 mils of colostrum, which um, meant that we could give her that in the first few days. So in the birth suite, we did give her some colostrum that we brought from home, and we started that process. Um,
And how
and then,
how
yeah,
was that relaying those wishes to all the,
yeah,
staff and nurses and midwives and
yeah.
doctors?
Yeah, I was really nervous about that, to be honest. I think even like during my pregnancy, um, my beautiful older sister, she's got two children who are 5 and 2.5, and she's actually still breastfeeding her youngest. And she also, she breastfed fed her first for about, 2 and a bit years. Um, and so I was actually really nervous even to sort of tell her that, I decided I didn't want to breastfeed, as well as some other friends who, have had these amazing breastfeeding journeys. But um, actually, like, my sister, my friends, they were so supportive. And that really, was really beautiful to see just how amazing they were, and supportive of my decision, knowing that, it wasn't an easy one. And certainly, when I told my obstetrician, he was very much, it's absolutely your choice. Didn't feel like there was any judgment there. Um, and then, again, I was worried about, going into the hospital and potentially, facing some pushback from the midwives. But I'd written out a little kind of, just some information about some thoughts I'd had about her birth and the postpartum period. And in there, I'd put, that we'd chosen not to breastfeed, and so after that, I really, yeah, I didn't get any pushback at all. I have heard that, and perhaps this is if you're sort of intending to breastfeed, but then you then end up needing to give formula for whatever reason in the hospital, that you need to sign a consent form. And knowing that, I wasn't bothered by that because I understood it might just be part of the process, but I wasn't required to sign anything in the hospital. And everyone was very, just generous with showing us, how to formula feed. Because I think there's actually not that much information. I'd really looked into it online, like how do I formula feed a baby? There's really not that much information about, starting formula from birth. And so it was helpful to have that help from the midwives, just even knowing, how much do we need to give her, to make sure that she was getting enough. How do we,
Yeah.
feed a baby with a bottle?
And how did you come to, because you expressed antenatally, was there
Mm,
ever a period you thought, oh, I'll express postnatally for a little bit too? Or did you just, like, how did you come up to that decision
mm.
of like the cutoff?
Yeah, absolutely. Yeah, because I think, it would be so easy to have, continued. And I certainly did have some thoughts, around the time of her birth that, um, maybe I could continue. But I really, I had made that really clear decision. I think for me, um, I knew that if I sort of continued to express, then my mature milk would come in, and with that, potentially the discomfort of engorgement or things like that. And obviously, people can breastfeed and, express and things like that and give their baby a bottle. But then I think people, who maybe haven't had a baby don't realize that even if you are doing that, you still need to be removing the milk from your breasts every, 2, 3,
Yeah.
4 hours in order to keep up your supply. And so even if your partner, if you're fortunate to have a partner who can help you, feed your baby with a bottle overnight, you're going to still need to probably wake up and pump
Yeah.
milk at that time.
Yeah.
Which is not to say that you shouldn't do that or anything, but this was just my personal kind of choice and experience. I think for me, it was really about kind of having that line in the sand and knowing that, I was doing what I felt that I could do to support Louisa, with her sort of digestive system,
Yeah.
getting those good antibodies and
Yeah.
immune properties in the colostrum. Um,
Yeah.
but that it would be better to stop it at that point when she was born. I did take medication to suppress the milk coming in and didn't experience really any kind of
Yeah.
discomfort in my breasts or a feeling that they were becoming full with milk.
Yeah.
Um,
And I can imagine the hardest
yeah,
part is making the decision one way or the other. Like, and then
absolutely.
once
It
you've
was really
made that
hard.
decision, it's
Yeah,
easy,
it was
easier.
really, yeah, I did deliberate on this for weeks and weeks. And so I think, yeah, part of as well, like that not then changing my mind once she was born was, a discussion I'd had with my psychiatrist. And she sort of said, like, yeah, look, I'm really, I'm proud of you for actually making this decision and kind of, deciding what's going to be best for you, because I think part of that was knowing that if I could look after myself and choose, what felt the best for me, because you don't really know,
Yeah.
I knew that I was going to be the most present and attuned mum, which was, to me felt more important than all the amazing benefits that Louisa would get from, breastfeeding. And I think also just to go back to that, deciding, to stop at her birth, um, I think I knew that if I started to, give her milk after she was born, that it might be quite hard to stop doing that, even if it was really impacting my mental health.
Yeah.
And I've certainly seen that, where people do become very sleep deprived, it's really hard to think logically about, what might be the
Yeah.
best thing for you or your family. Um, that's, yeah, and I certainly don't want to sound negative about breastfeeding at all. Like, it's obviously such an amazing thing that we can do for our babies, but this was just what was
Yeah.
was best for me.
And you've got a
And
beautiful,
yeah,
content baby sitting in front of us on the screen who's just fallen asleep while
exactly.
you're talking.
I know, I
Beautiful.
know.
And
She finds my voice very boring.
now you mentioned this at the start briefly. You made the decision whilst pregnant to stay with your parents postpartum with your husband and baby.
Mm.
Can you
Yeah.
tell us a little bit more about that?
Yeah, well, I guess part of that was that, going back to uh kind of the timing of her conception, we had thought about waiting a couple of months because my husband had to sit some important exams for his career. And so those exams actually ended up being about 6 weeks after she was born. And so knowing that he was going to be, in that really intense studying phase right around the time that she was born and in the early postpartum period, I knew that, we were going to need that support. And or at least that, obviously it's possible to do it without that support. But again, trying to just think about how could we make that period of time as enjoyable and as kind of, really to help us thrive, not just kind of survive.
Yeah.
So, we were so fortunate that my parents were willing to have us stay with them for about, yeah, we ended up staying for about 7 weeks because she came a bit early.
Yeah.
And that was so wonderful to just have that extra support. You know, from my parents with things like meals, laundry, all those extra things that you have to do on top of looking after a newborn
Yeah.
baby. And it just meant that, I could really just sink into that, being a mum without having to worry about all those domestic tasks. And it also meant that my husband could enjoy time with Louisa when he wasn't at work or studying.
Yeah. Not having to do all the
Um,
jobs. Yeah.
exactly, yeah. And then we were really lucky that my husband's parents who live overseas, they were able to come to Australia for 3 weeks after we kind of got back home. So really the first 10 weeks of Louisa's life, we had help from our parents, which was just so, again, so lovely to have that support and just, I think, helped set us up in such a positive way
Yeah.
to sort of get to know her routine, figure out, how do you look after a baby for the first time?
You're creating a village.
And yeah, exactly. And yeah, like obviously, not everyone's as fortunate to have parents who live close by or who can, come interstate or overseas, to stay or things like that. But I think it really helped again, just with the mental health side of things, meaning that I could get enough rest. I almost, felt like I was sleeping more than I'd been in the last sort of stages of pregnancy,
Yeah.
because we were so well supported.
Yeah. And do you feel the postpartum anxiety and like mental health side of things are pretty stable?
Yeah, absolutely. Like, I think, again, I've just been so conscious with keeping everything up with, booking those appointments with my psychiatrist and psychologist around the 6 week mark, like, obviously, I had the checkup with the doctor, I went and saw the pelvic floor physio, but I also made sure that I was kind of having those mental health
Yeah.
checkups. And then, yeah, like, honestly, I think, of course, there's things that all new mums are going to be worried about. But I don't think I've experienced any more anxiety than the average new mum.
Yeah.
And so I'm really,
Amazing.
pleased about that.
Yeah.
Yeah.
Okay, let's finish off with just a little bit about your postnatal, like the physical recovery. You mentioned you saw your
Mm.
pelvic floor physio. You're back into Pilates. I've had you for a few lovely
Yeah.
classes with the app. How have you supported your, like you've discussed your mental recovery, like mental health side
Mm.
and emotional supports, but with your physical recovery, what are you doing at the
Mm.
moment and how,
Yeah.
yeah.
Yeah. So I think I really, those first, um, 6 weeks just made sure I was really resting. And I think one really amazing thing that my pelvic floor physio did was offer like a 2 week phone checkup just to kind of really touch base. And even though at the hospital, the pelvic floor physio had sort of popped around briefly and given me a handout on, what to do, what not to do, pelvic floor exercises, etc. It's very hard to take that in when you're
Mm,
only 24, 48
yeah.
hours post birth. And certainly I can imagine it would be even harder if you'd had a particularly difficult
Mm,
or traumatic birth. And so it was good just to have her kind of correct some things that I was doing. I think I was straight back into kind of doing pelvic floor exercises the same as what I'd been doing in pregnancy. And she was like, oh no, you've really got to, like, you should only be holding your pelvic floor squeeze for if it's your baby's 1 week old, you hold it for 1 second. If your baby's 2 weeks old, you hold it for 2 seconds and build up from there. So that was really helpful and really helped as well with a little bit of sort of urge incontinence that I had developed postpartum because or was it stress incontinence? A little bit of incontinence, that was sort of happening, which actually I think the physio felt that was just that my pelvic floor was tired
mm,
from me trying to do too much with my pelvic
yeah.
floor exercise.
Yeah.
And so it immediately kind of improved after I uh, pulled back on that.
Yeah.
We also immediately kind of started to get out for little walks and things and slowly built that up. And it was really nice to, have that time, say, with my husband or with Louisa or with my mum and the fresh air, but also knowing that I was starting to just, support my body to get better. And then at the 6 week mark with my checkup, yeah, the pelvic floor physio suggested your app, which, yeah, has been so amazing with kind of getting me back into doing some Pilates and strengthening and things. I found that really great, along, with just sort of daily walking, both whether it's, in the park or to exercise, again, exercise in inverted commas,
Yeah.
a nice like sort of brisk walk with the pram around the park, or, we do walk a lot just to kind of get out and about doing errands or going to the shops,
Mm.
etc.
And I'm very interested to hear this question because I know a lot of people sign up to an app, But an app, it's great because it's financial. It's a lot more accessible than, one on like clinical Pilates at physio clinics and all the rest. But then downside is it's an app, so it's very easy to ignore. And I know you were great at attending, those from 6 weeks onwards. You've been quite consistent with how many workouts you're doing with the app. How did you stay motivated or stay structured? How did you best utilize the app? Because not everyone can do that. Or that's
Yeah. I mean, I think for me, at the time, sort of doing those live classes and having that kind of weekly face-to-face sort of, it was set in my diary. And I think like to extrapolate that on that, being able to kind of, schedule it into your diary, because one of the great benefits of an app is that it can be done at any time, but often things that can be done at any time will be done at no time. Yeah. So, actually saying like, okay, my goal is to do 2 or 3 classes a week. At what times of the week is it going to be most realistic for me to do those? Can I put that in my diary and actually just set it as like an appointment and do that? And I think also, again, like something that you emphasized was that, it didn't have to be done when Louisa was napping. That actually including her in the workout or having her there on the mat next to me happily playing meant that, it didn't have to, it wasn't kind of taking up time that otherwise I might want to be, doing laundry or kind of,
you time.
Because I think it's so easy to kind of let those household tasks just take over.
Yeah,
when she's asleep.
Absolutely. I think for anyone trying to just find the time to exercise when your baby's sleeping, I think good luck. Because when your baby's sleeping, I know personally with my 3 babies, that was not the time that I wanted to be exercising. I would try to do all my jobs with my baby, involving them, having fun with them whilst I'm doing a workout or sorting the washing. And that meant when the baby is sleeping, I got to do, like obviously it doesn't always work out like that, but that would be the goal, is I'd be able to do something for me when your baby slept. Yeah.
Yeah, and I think, particularly like Louisa, she's more of a cat napper. So, like she's an excellent sleeper overall and she sleeps really well at night, but the toss up or the trade-off is she does tend to kind of cat nap throughout the day. And so it might only be a 30-minute nap, that she's asleep for. And you've really got to like, as you said, treasure that time to recharge so you can be like energized and ready to go again when she wakes up.
Yeah. Amazing. Look, I'm aware of the time. Eugenie, to finish off with, for anyone listening today that's perhaps embarking on their pregnancy journey, perhaps they're about to have an induction, or perhaps they've had similar mental health challenges to you. Are there any final words that you'd like to say?
I think just, if there's something you're anxious about or worried about, like I was, say, even going into pregnancy with my history of the mental health challenges or going into the induction, just sort of, getting support around that, having a team of people, whether it's friends and family, whether it's health professionals, and even like using resources online, like say with the induction, I was able to find so many great, stories and things that were really helpful, I think. But I think definitely having that support is so, valuable.
Yeah, amazing. Thank you so much for joining me, Eugenie. Louisa's been amazing. Can I just say, awake and happy the whole time. She's
hopefully her little noises are not going to interrupt the audio too much.
It's gorgeous.
But she's very content. She was happy looking at your face.
And thank you so much for sharing your story. And I really do appreciate, I appreciate you taking the time out and sharing that really valuable story that you've had.
Oh, thank you. And well, thanks for what you've been doing with your app and your podcast, just providing all that information for women in such an accessible way.
Amazing. Thanks, Eugenie. We'll catch you soon.
Thanks, Kath.
Thanks for listening to the Pregnancy, Birth and Recovery podcast, brought to you by Fitness Mama, your app for home-based, physio-led pregnancy and postnatal workouts. If you found this episode helpful, please tap follow, leave a quick review, and share it to your stories. Tag at kathbequee.physio. I'd love to connect and cheer you on. And don't forget to check out the free trial at fitnessmama.com/free to start feeling confident, strong, and supported today. Until next time, remember, a strong body, a confident birth, and empowered recovery is something you deserve. This podcast is for informational purposes only and is not a substitute for individual medical advice, diagnosis, or treatment. Please consult your healthcare provider for your personalised guidance.